Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
We're from Maragal Medical. Disc bulge, disc herniation, disc protrusion. What does it all mean? We're going to talk to you about what a disc injury involves and why the doctors at Maragal Medical will be able to take care of you conservatively without the use of medication or surgery. Okay, so we have a lot of patients that come to us with problems with their lower back, and after an MRI, we find out they have a disc injury. So when a patient's diagnosed with that disc injury, automatically sometimes people think, I'm gonna need surgery, but that's the last option that we're looking at, right?
Yeah, discs rarely need surgery. If you think about when we talk about all the degeneration process that takes place that are related to a person with disc issues, very, very small percentage will go toward surgical issues. But the problem is it's a lot of confusion. You've all gone to the doctor and had, a back issue, you eventually get an MRI. There's just a lot of words out there that kind of really get confusing between the disc bulging and the disc protrusion and what's extruded and what's not extruded and, what's pushing on a nerve and what's torn and what's not torn. These are all things that happen relatively normally in disc pathology, but realities are they mean different things, but the clinical evaluation is most important because we know you're hurting, but is it pushing upon the nerve causing the sciatica?
Yep.
Is it causing inflammatory process on the nerve that's going to settle down? Is there actually a direct pressure upon the nerve that might need considered surgery? So there's a lot of differences regardless if it's a bulging disc, a herniated disc, a protruding disc. It really looks at where it's located and what's touching.
Yeah, and what's great is we always look for the conservative options first. So at our practice, we have the ability to treat our patients kind of the one-stop shop where we combine medical care, chiropractic treatment, and physical therapy. But oftentimes patients get a little nervous. If you have a disc injury, the last thing they want to have is a chiropractor twisting them around. But in our clinic, we invested in these specialized tables. They're called Cox decompression tables. Some gentle traction is applied to the patient's lower back. We really match that up with their MRI findings so we know exactly what level we're looking at. It's a very gentle, slow procedure under the doctor's control, and the whole goal is to kind of stretch those joints out. It causes a negative pressure, which helps to draw that disc material back in to the midline. Oftentimes it takes, a longer course of treatment with those more severe diagnoses. But, the chiropractic treatment is a real gentle way of helping to resolve a lot of the flares from the disc itself.
Yeah, let's look at the idea. We're really concerned about getting that sciatica down, that nerve pressure down. So anything that we can do to help alleviate pressure.
Yep.
And that's what we're doing. We're trying to get some separation of those spaces. There's the joint that gets inflamed, that gets all swollen and thick. There's the nerve itself that runs past the joint and sits right behind the disc. So there's this little canal where the nerve goes through. So if we can give that gentle traction to open space, wonderful. Sometimes it's so inflamed that I'll have to use medication.
Right.
We'll use something to get the acute inflammation down and then also do the traction and be able to get some separation. And if we think about the spine moves all different directions, right? So if we go forward, we put a little pressure on the disc, we move backwards, a little more pressure upon the joint. That's what the chiropractor is going to do, to try to make sure we go in the right direction to get that motion to alleviate the area where it's most narrowed or most pressure. And that's what the ultimate goal is, to alleviate that area, not use a lot of medicines, and definitely not needing surgery.
Right, and I like our approach too. Sometimes we need that medication to get the symptoms down, but then we get the patient and wean the patient off the medication, and we can use some, conservative options like the Class 4 laser, which also helps to decrease pain and inflammation when applied right to the lower back itself. It's conservative, there's no side effects. And then once the patient is stabilized, we can get them over onto Colleen's schedule, my wife, our physical therapist, and we can work with the fancy robotics to really work on strengthening the patient's core so we get some longer term benefit to make sure that, prevent this from happening again.
Sure, and you think about just that idea of having it all right here. We are looking at it clinically, looking at you improving functionally. I have a lot of patients come back and say, well, I don't want to do that. It might aggravate the disc again, or we need another MRI to see what it looks like. Well, you don't, because if things have settled down and we know what disc levels are problems, we are going to follow you clinically. We're going to follow you in ways in which you can improve, because we know you're less likely, or probably not even chance of likely, needing surgery as you settle. And that's why the core strengthening is so important at the end of it all, because that's, again, the acute treatment in the pain clinic might be quick injection, they don't see you again.
Right.
The orthopedist or the spine surgeon, if you don't need surgery, they don't need to see you. Who are you seeing on a regular basis to follow them for the acute stage, through that transition of getting better and then finally getting stronger? That's where we can incorporate all right here at Maragal Medical.
Yeah, and our injection therapy includes, some regenerative injections and some intramuscular injections where we don't use cortisone. We're looking at using, products that are helping to repair damage to the soft tissue into the area, all incorporated. We can brace the patient short term while they're working on strengthening your core. So we really can look at the patient as a whole, and for those disc cases, we can certainly manage it appropriately. If you have more questions about the services that we have to offer here at Maragal Medical, please check out our website at maragalmedical.com. Well, that's it for today. I hope you learned something, and we'll see you again soon.
Bye now.